The common causes of bleeding or spotting during pregnancy. Bleeding or spotting during the first trimester, especially the first 3 months, is very common, and most women experience it and often carry the pregnancy to term without any complications. It can be normal or abnormal. What causes bleeding during pregnancy? Implantation bleeding. This is bleeding that occurs when the fertilized egg implants in the endometrium or the lining of the uterus. This happens at the time of the expected menstrual period. Changes in the cervix. Hormonal production during pregnancy causes changes in the cervix, which makes it highly vascularized and softer, hence prone to bleeding. Infections. Infections in the genital tract may cause bleeding during pregnancy, which may be accompanied by an abnormal discharge. Miscarriage or pregnancy loss. Miscarriage is the spontaneous loss of the fetus before 20 weeks gestation. Miscarriage is the most common cause of bleeding during pregnancy, especially during the first 12 weeks. Types of miscarriages include threatened miscarriage, complete, incomplete miscarriage, blighted ovum, inevitable abortion. Causes of miscarriages include genetic abnormalities, embryonic causes such as chromosomal abnormalities. The most common chromosomal abnormalities are 45X karyotype, trisomies, especially trisomy 16. Maternal health factors include polycystic ovarian syndrome, uncontrolled diabetes mellitus, severe hypertension, untreated thyroid disease, renal disease, systemic lupus erythematosus, and antiphospholipid syndrome. Maternal infections such as rubella, cytomegalovirus, listeria, toxoplasmosis, malaria, brucellosis, dengue fever, bacterial vaginosis, and influenza. Acute maternal causes like corpus luteum deficiency. Extreme maternal age, very young and elderly. Those above 35 years are at risk of experiencing pregnancy loss. Structural abnormalities of the reproductive tract such as the uterine septum, cervical incompetence, and fibroids may cause pregnancy loss. Other factors include tobacco use, alcoholism, use of cocaine, and high dose of caffeine. Molar pregnancy, also known as gestational trophoblastic disease or hydatid mole. This is an abnormality in fertilization that results in the growth of abnormal tissue within the uterus. Ectopic pregnancy. This is a pregnancy outside the uterine cavity, mostly in the fallopian tubes. Subchorionic hemorrhage. Blood collects between the gestational sac and the uterine wall. Trauma to the abdomen. Trauma to the abdomen may cause bleeding depending on the impact of the trauma. Placenta previa. This is when the baby's placenta partially or completely covers the cervix. Placenta abruption. This occurs when the placenta detaches from the wall of the uterus before delivery. Bloody show. This usually occurs at term, and it is mostly an indication that labor is near. Premature labor. Any bleeding during pregnancy is a cause for alarm, and you should consult your obstetrician.